history, everyone is contributing to the growth and development. And I am really very proud to see by my 2 consecutive visits. Last time also I said same thing. Today I am very happy that Shiva has also been able to make it to this institute, and definitely a great example of dedication. I'm sure that the days to come, research will improve upon its academic curriculum, go to much higher level, because the type of the quality of faculty, residents, and dedicated doctors, as well as the senior professors who are the guiding force, president of SARC, chairman of this institute, and chairman of so many others, so many professors are there. I think it is a constellation of a galaxy of stars, different capacities, who are going to make this institute shining the map of entire world, particularly from entire Asia, Southeast Asia. Thank you very much for inviting me to speak.
So much, sir, for your inspiring words. Now, may I request share a few words.
Good evening, everyone. I'm really very happy that I could make it along with Dr. I had heard about this about Dr. Professor Anil Kumar Jha from Sandeepan. He was raving about the institute, that it is premises are beautiful and it has got so many people associated with it. And I find all that true. I have had a short to Professor Jha, and I was really impressed. And I know about the messages that are exchanged, though I don't know the exact content. I finally have met the person with whom the messages are exchanged every morning. I'm happy and about it, and I'm very happy to see you all. And I hope that I am able to make you all happy with my dermatopathology presentations that I will serving tomorrow. I am practicing pure dermatopathology, as I was just sharing with Ramchandra, that I was doing general surgical pathology for many years, 20 years or so. And after that, during the COVID times, I shifted to pure dermatopathology. The lab was established in pure dermatopathology 2020 and 2023. I have seen that after focusing completely on dermatopathology, my learning and my knowledge and my expertise in the subject is also in. I hope to share with you all tomorrow. I have a CPC of interesting cases which all of you are going to participate. Very interactive. It will not be a didactic lecture. The answers will be coming from you all. So I hope that I can make you all happy as I feel today after meeting. Thank you so much. I'll not take much time. Thank you.
Thank you, ma'am. We are also very honored to have you here. Now, moving on the next I would like to request one representative from Masaya Pharmaceutical. Without their support, this program would not have been possible. A managing director, Mr. Sanjeev Kumarji. I would like to request share your words with us.
Thank you. such a great professor, Sir Anil, fully suggested and this materialized in three. What us about Masaya? We are a startup company of 2.5 years now. We realized after working for years that still something missing in dermatology, which probably as a part of dermatology marketing, yes, we realize that there are unmet patient needs. There are pain points of patient, and it will be nice if we can make a drug, can make a slight but positive change in the lives of people, and that's how we are very new in Nepal, only 6 months now. Thank you all very much for, especially sir, for accepting our request to hold a CME. One of the strength of Masaya and us is, sir, that we all are academics, and we promise at this point of time that in Nepal as well, you will find us at the front of all academic activities in future as well. Thank you all very much.
Masaya Pharmaceutical once again. Now we are moving ahead with the symposium of today. So to chair the session, may I request Professor Mathur and also to accompany sir, Dr. Would you please front, sir? Dr. Padma, I would like to request to take a seat in the front and to take over the rest of the session. I would like to request both chairpersons. I will be
Good evening to everybody. Students, it's an honor for me. Been, I've been given entirely respect, but having friends put on the self doubt that he, therefore I am here. I'm Professor Mahesh Mathur of the, I'm working there of medical for last 7 postgraduate teaching, 20 student already. First of all, that I like to congratulate Professor Jha for his untiring academic is hardworking. Therefore, this unanimous elected entirely because of his heart. I know already, starting from foundation of team, might not be visiting, but we are in already. So happy to be here today to chair the session. One of the be here entirely for the academic center of excellence. I'm proud. In days time, we can't build such a magnanimous, you know, center that cannot be erected. It is his entire hard work. He's a chairman of so many staff. He, I think whole evening will be there if I start telling about him. So thank you very much. Accept my congratulations, sir. Very my friendship. Happiness to be. Now, before I take much time, let us start with the session for which we. May I request first speaker.
First speaker is Professor. Yes. Hello. Tiny worms coming out of skin. A rare presentation by Professor.
Dr. Sisti does not require any introduction. Already such a senior professor, Hartford Medical University, and our friend that we have been there examination very many times. Most of us already know her. We don't want to waste time much more, rather hand over mic to her. Madam, please.
Thank you very much, Mathur sir and Dr. Respected chairperson, professors, colleagues, residents, and everyone present here. So I'm presenting a rare case today. We saw this patient just around 1.5 months back. Because we have put the heading as tiny worms creeping out of skin. So when I saw this tiny worms, I could relate it to earthworms. If you see this picture, these are earthworms on the way to Fulchoki. Once in the rainy season, I was driving there and the whole ground was filled with earthworms. So I could relate. Just for fun, I kept this picture. A 10-year-old girl came to dermatology OPD at Nepal Medical College with chief complaint of worms coming out from the skin of hands, legs, nose, lips, and she even noticed it in the stool. So, history of presenting illness, she had noticed, basically her parents had noticed worms coming out in stool 4 months ago. At that time, she had pain, complaint of pain abdomen, but the parents were not sure whether she had fever or not. She was seen by a pediatrician that time and she was diagnosed as enterobius vermicularis infection. So she was given 3 doses of albendazole, 400 milligrams, 2 weeks apart. So after 2 weeks of completion of treatment, there was disappearance of worms, so they were doing well and good. But after 1.5 months of completion of treatment, right, please, worms were noticed in the stool again. So they started seeing worms in the stool again, but this time it was accompanied by creeping, some small worms-like structure creeping out of different parts of body, especially face, legs. She also noticed coming out from the nose, lips, even lips and hands. When we asked the patient, she told that she would get a feeling of something crawling and inside the skin, and immediately after that, she would notice the worm coming out of the skin. So I have some videos shown here. So this was a video sent by her mother. The most important part is I just appreciated the child's face. Like she was so quiet, she was so calm. I could just imagine how we all would feel when see that worm, but she was sitting there quiet and calm. One of the videos taken by her mother. Another video again, worms, small white worms coming out from the skin of the hands. And finally, this picture was taken when she was in our OPD, this video. So we can appreciate at two places simultaneously, small whitish structures are coming out, creeping out. You can see the movement, but if we appreciate the background, we don't see any kind of redness, we don't see any kind of like crack kind of thing. We asked for additional complaints like pain, abdomen, nausea, vomiting, diarrhea, which was absent. There was no history of myalgia, no history of fever, cough, chest pain, eye pain, skin swelling, or pruritus. The girl was studying in a private school. She was from an educated family and financially good as well, and she didn't have any other medical illness as such till date. So as soon as I saw this girl with the worms coming out, the first thing that came to our mind, obviously we all know about, we have heard about cutaneous larva migrans still. That is the first thing that comes out. And the other differential diagnosis to think about was loa-loa-loasis. So we, including faculties, residents, we started searching all the books in the OPD. Then we started surfing in the net as well, find out whether there are any other differential diagnoses. After some time, what came to my mind was we should consult a microbiologist in our medical college. We also sent for investigations. She had already done few investigations, which complete blood count was normal. There was no eosinophilia. Chest X-ray was normal, and we asked for ultrasound abdomen also. It was normal. And we also asked for a pediatric and ophthalmic consultation just to rule out if there is anything. That was normal again. Next thing, what I did in the meantime while we are doing, I consulted a microbiologist friend in our medical college, and what they suggested to me that let's get the worm and observe it and find out, maybe that would be helpful. So next day we asked the come with worm in normal saline, patient party, basically mother. So next morning she arrived now to our OPD with the worm in a bottle of normal saline. So microbiologists, they also had lots of problems. So they were confused in the initially because they had not seen something similar till date. So they consulted few microbiologists from other medical colleges as well, and to our surprise, they diagnosed it as gnathostomiasis caused by Gnathostoma spinigerum. So, but why was this diagnosed? That was my question. First question I asked was that. Next slide. So, if you look at the worm, that the first picture is worm in the bottle of wine, and this is with the magnifying lens. The size of the worm, it just 11 by millimeters by 0.65 millimeters. So it is a very small worm. When we think about cutaneous larva migrans, there are multiple causes of that, but compared to those worms which causes that, other causes, they are larger in size. So this was one point in favor of gnathostomiasis. Now, the morphology of worm was another important thing, what they suggested. The cylindrical body, next slide please, next. cylindrical body with a bulbous head. That is as shown in the picture is very, very classical. Next. And if you look at the skin or the surface cuticle, there are three outer layers in the skin as observed here. That is again a classical finding in gnathostoma. Next, please. And in gnathostoma, the tubular extends throughout the body, unlike other worms. Here, that is one different. Now, they observe the head end of the worm with magnified, and this was another very, very classical feature. The cephalic region was covered by transverse rows of cuticular spines. These spines usually extend throughout the body, but very, very classical at end, and that again favored the diagnosis of athostomia. And when this spine was further magnified, next picture please, this spine which we shown by this arrow confirmed the diagnosis of athostomia. Next please. What is nathostosis? The parasitic infection caused by third stage larva of nathostoma. There are actually 10 species of nathostoma, but Nathostoma spinigerum is the common one. It's commonly seen in tropical and subtropical regions and endemic in Thailand, Cambodia, Laos, Myanmar, Indonesia, Philippines, Malaysia, and Vietnam. But there are few case reports from China, India, Sri Lanka, America. Most of the case reports are from usually seen in travelers, those who travel to Southeast countries, they get this infestation. Next, please. So it's a foodborne zone. Actually, human is an accidental. And next thing which causes factor, important factor is eating raw fresh water fish or shellfish, raw poultry has been found to be the cause for this kind of infection. And this is commonly seen popular delicacies like sushi, sashimi, ceviche. And this shows the actually the it's seen in the sea animals which gets transferred to other animals and accidentally it third horse. Next, please. Now, clinically, Mathostoma has two forms, cutaneous and form. What happens is within few organisms, there are signs and symptoms, the urticaria, vomit, diarrhea. What happens here is that the larva migrates through the fur, and then comes the cutaneous, where larval worms migrate to. I think our patient, and gradually this may penetrate to and viscera like lungs, eyes, ear, gastrointestinal system, and genitourinary and central system visceral disease. But it is reported that majority of cases have with the disease. Pathostomiasis is the most manifest, and depending on different countries, it's found named as different words. And two important cutaneous findings are migratory swellings, and sometimes they can have a pure orange skin. The other is the eruption lava migraines. But in our patient, we just saw the work out, but this kind of erythematous tracts were. What were the points in our patient? When we went retro, after we diagnosed her, had she